Good afternoon. Welcome to the daily briefing, day 303 at the EMA office here with the Chairman Kern and Sam Behrman from the Health Department. Sam, it's a Sunday question and answer day, and you have our numbers first.
I do, and our numbers are looking pretty good today, so it's a good Sunday. So as of today, 223,441 St. Clair County residents have been tested, which is an increase of 1,624 from yesterday. We are at 23,150 positive test results, which is an increase of 169 from yesterday. And that does include both males and females from under the age of 10 up to their 90s. Today, our daily county positivity rate is 10.4%. We are at 200,291 negative test results, and we are announcing no new additional deaths, so we remain at 354. For those who have completed the IDPH required 10-day isolation period, we are at 20,500. For state totals, 14,103,289 have been tested, with 1,028,750 positive test results, which is an increase of 4,711 from yesterday. And for deaths, the state is reporting 17,574, and that is an increase of 81 from yesterday. For hospitalization numbers in St. Clair County, currently we have 104 patients that are admitted due to COVID-related reasons, and 11 of them are on ventilators. Regionally, we have 202 patients that are admitted due to COVID-related reasons, and 15 of them are on ventilators. For our long-term care facilities and congregate living facilities that are currently or previously been in outbreak status, these are cumulative numbers, and we will only announce any facilities that have had changes. Brea of Belleville has 83 cases and 8 deaths, and that is an increase of 1 case for that facility. Freeburg Care Center has 128 cases and 4 deaths, and that is an increase of 1 case for that facility. Four Fountains has 136 cases and 29 deaths, and that is an increase of 1 case for that facility. And finally, we have Integrity Healthcare of Belleville, and they have 89 cases and 2 deaths, and that is an increase of 1 case for that facility. And I will turn it over to Chairman Kern for his update.
Okay, Sam, thank you. We'll go into the zip codes. In 62201, we go up 5 COVID positives today to 479. 62203, we're up 1 to 529. 62205, up 4 to 542. 62206, up 4 to 1,079. 62207, up 3 to 495. 62208, up 6 to 1,308. 62220, up 4 to 1,580. 62221, up 14 to 2,211. 62223, up 10 to 1,384. 62225, up 1 to 116. 62226, up 16 to 2,511. 62232, up 4 to 747. 62240, up 1 to 118. 62243, up 2 to 603. 62254, up 4 to 655. 62257, up 1 to 258. 62258, up 4 to 820. 62260, up 3 to 584. 62264, up 3 to 276. 62269, up 35 to 2,573. 62282, up 1 to 50. 62285, up 4 to 428. Sam said 169 new positives today with 1,624 tests. Brings our daily county positivity down today to 10.4%, which brings our rolling average then down to 14.1%. And this is the third day that we've gone down, so we're in a bit of a downward trend. with our rolling average, which is always a good sign. Regional positivity today is down to 12.6%, derived by Bond County at 6.2, Clinton County at 7.1, Madison 8.2, Monroe 9.8, Randolph 8.7, St. Clair 9.2, and Washington County dialing in today at 15.8%. Herb, it's question answer day today.
Questions and answers. Dave, Brian, and you've got some questions here, so we'll move right into them.
Okay. I will start with health department questions. And as we did last week, there's quite a bit related to the vaccine. So I'm going to read through these vaccine questions, and then we'll work through the answers with Sam one by one here. But the questions that came in about the vaccine, the first person said, approximately what percentage of the 1A population is left to vaccinate?
So we are looking at between 50 to 55% that we have already completed. So we are about halfway done, and that will depend on us being able to finish on what our allotments are from the state in the coming weeks.
Okay. The next one was, has there been any clarification on what tier ages 60 through 64 with pre-existing conditions fall under?
So that's kind of a two-part answer question. If you have pre-existing conditions, that would put you in 1B. But if you are in the 60 to 64 category, that would put you in 1C. We are still awaiting the updated IDPH guidance, which is version 4.1 of the vaccine planning guide. And as soon as we get that and we have those specifics that makes any changes to what the tiers currently are, we'll be sure to post some updates.
So there definitely could be some changes still forthcoming.
It's very possible.
Before we move into those tiers.
Yes, it's very possible.
Okay. The next person says, do we know if something happens with supply and you don't get your second vaccine in 21 or 28 days, what could happen?
So, the state as well as us as St. Clair County, we have plans in place, and it is best to get your vaccines as close to that 21 and 28 day mark, depending on which vaccine you get, as possible. But sometimes things are out of our hands, but our plans are to, as soon as we receive that information from the state, to have those appointments available so people can get those vaccinations as close to that second dose time frame as we can.
Okay. The next person says, obviously we know we're supposed to get our second shot from the same company as the first one, but what happens if we don't?
So there are no case studies that have been done that someone has received their first vaccine of Pfizer and then the second vaccine brand of Moderna. I cannot speak for other counties, but I can tell you that St. Clair County Health Department will not be mixing manufacturers. Your first dose will be the second as the same dose. Or I'm sorry, the first dose will be the same as the second dose.
The next person says, how will residents who have completed the questionnaire indicating they want to be notified about the vaccine receive that notification? I, like many others, don't answer calls to my phone when I don't recognize the number. Will it be a robo-type call with information on how to proceed, or will I have to call back with information?
No, how we leave the information will either be an email or a phone call, and I completely agree with you. I often don't answer numbers that I don't know on my personal phone, but a message will be left. You won't have to call the health department back. The information that we are calling to let you know about will be left in message form.
Okay.
And we'll be utilizing the code red if we have to, some type of notification. There's going to be more than one.
Oh, yes, and all of this information will obviously be when we're moving from tier to tier on the health book, or on the Facebook pages of both the health department and EMA, as well as the health department website. There will be many other forms of notification besides just phone calls and emails.
Okay, the next person says, what type of sites will be used for 1B vaccinations? Is it going to be CVS, Walgreens, or some large site like the fairgrounds or other large facility?
So right now, we have one ready to go, which is 330 West Main, and we are working on others for the 1B category. When we get to 1C, that is when you will start seeing the vaccines in a lot of our local pharmacy chains and being offered at other places such as doctor's offices. But 1A and 1B will be at 330 West Main and some other alternative sites that we are looking into.
Okay. Next person says, how will vaccines be handled so that we don't have lines of people waiting for hours like other states?
That's a very good question. And yes, we do not want people waiting in line for hours as well. So what will happen is for those who have filled out the form and we have your information, we will be sending out information on how to schedule yourself for appointments. And the appointments will tell you when you need to be there, what time you need to be there. And to help prevent people that are trying to get in line that don't have appointments, we will have staff out in the parking lots and in the lines that people are waiting in to help section those people off that don't have appointments.
Okay. Next person says, I'm a member of the clergy who does hospital visits and funerals. Would I be considered 1B?
So if you are clergy that goes to hospitals and you are present in funeral homes, you would be considered 1A.
Okay. Will school districts be offered a localized site for vaccinations like a junior high school, similar to what they do with flu shots?
So we are working on that as well, but please remember that with the 2 brands that we have right now, the youngest age that can receive this vaccine is 16 years old. So anyone below the age of 16 is not eligible for the vaccine, but we are working on other vaccination sites throughout the county.
Okay. Next person says, will vaccines be given by age or health condition?
That answer is both. You will see in 1B, the category is 65 and older and those with underlying health conditions. So both of those will be taken into account when we move to 1B.
Now, 1B is 65 and older, 1C is pre-existing health conditions.
Oh, yes,
correct?
I'm sorry. 1C is pre-existing health conditions. Yes, you're exactly right. 1B is for 65 and older. 1C is for health conditions, but as we move down the tiers.
Yes, ma'am. Okay. Next person says, if a first responder lives in St. Clair County but works in a different county, where should they get their vaccine?
That's really up to them and what their company would like them to do. Any resident of St. Clair County, regardless of where you work, is welcome to come to one of our vaccination sites as long as you fall within the tier that we are currently vaccinating.
Okay, the next person says, is there a way to find out if my Vaxday survey submission was successful?
So that is a very good question as well. We are looking into that because we want people to be confident that we did receive their information. So when we do send out the updates that they did get it, we are looking into how we want to let people know if that is an email back to the email address that you submitted saying we've received it. We are looking into that and figuring that out, but we will be doing something.
And when you finish the sign-in, it says this was successful.
Submitted, yes.
You are submitted. So if you didn't see that message, then we know for sure that you didn't make it all the way through the process. But beyond that, Sam has the right answer.
Okay. The next one says, do employees of senior independent living apartments with social services qualify for the early rounds of the vaccine similar to group living and nursing homes?
So if they are 65 and older, of course they would be able to in 1B, and if they are pre-existing health conditions, 1C. But the CVS Walgreens partnership that the state has put out, their first goal is to get through all of our long-term care facilities and our specialized living centers, and then per the state, the plan is to move on to senior living communities. So that would be assisted living, and also those senior, just community apartment type facilities.
Okay. The next person says, how many vaccines have been distributed in our county?
So we are approximately at around 9,000 that have been staff that have been vaccinated that fall under that critical frontline healthcare worker.
And just as quick as we're getting vaccine in the county, it's being put into the arms of
Oh,
these healthcare
absolutely.
workers.
When we get it and it's delivered to the hospitals, those hospitals are setting up clinics that day, and the vaccine is not sitting on shelves. It's being put into the arms of all of our frontline health workers.
Okay. So now non-vaccine related questions, still for the health department. Next person says, approximately how long are test results taking at the IDPH Center in St. Clair Square?
So we are hearing that they are getting turnaround results anywhere between 24 to 48 hours, which is great. 2 days is a really great turnaround time. I remember several months ago when we were looking at between 5 and 7 days, but looking at between 24 and 48 hours.
Okay, the next one is, I was wondering if there's a way to break down deaths by zip code.
So we announce the deaths daily just as a cumulative count. I can certainly talk to the EMA staff offline, and we'll let you know if we're able to do that.
Okay. The next person says, of the sample collection sites you routinely mention, do sites using PCR, is that the type of test they're using? And if not, do they forward a sample on for PCR testing if they're using a rapid test?
So the PCR is what we are talking about when we talk about the ones that you have a sample in either your nose or your mouth that gets sent to the lab. Like we're talking about the St. Clair Square testing site location that take 24 to 48 hours. Those are PCR tests. The rapids are the ones that you have a result within 15 to 30 minutes. So if you do a rapid, we are not automatically sending any specimens from a rapid test onto a PCR.
Okay. Next person says, a month ago I tested positive for COVID. If I am exposed to someone today, will I still need to quarantine since I'm within my 90-day immunity?
So no, because we know that at a minimum, we are seeing antibodies at 90 days. The state has also said that we are seeing immunity well past 90 days at this point as well.
Okay. And the last health department one that came in says, what options for getting information to seniors who are not tech savvy, linked to Facebook, can't maneuver on websites with confidence, or have anxiety with computers? What are we doing to help them?
Sure. So please be rest assured that we have, thought about that as well, and we will be putting out information in multiple ways, whether that be our local news stations, our local papers, Belleville News Democrat. We are looking at alternative ways other than just technology on computers and phones to get that information out to those that might not have access to it or aren't comfortable with it.
Okay. Thank you, Sam. We're going to move to Chairman Kern for a few questions that have come in. Chairman, the first person asks, what is the end game in St. Clair County? With no light at the end of the tunnel, nothing to look forward to, what are we looking for as an end? We have a good idea who is at risk for death. We have cheapened the case count to include probables in addition to confirmed. It seems we're more concerned about making it look worse than finding a solution.
So this isn't a game. This is a fight, and a fight against a very deadly virus, a virus that if it doesn't kill people, it causes very long-term effects for many. And so this is a serious thing. As far as positivity rates and how they're being used, I think they're showing that they are a good leading indicator. Right now we've got 202 people in our regional hospitals. 15 of them are on ventilators. So we are in the midst of this pandemic. As far as where we are headed, we're headed towards trying to get needles in people's arms so that we can get immunity in our community, so that we can get to a level of immunity where we can all get out and get back to normal. It's going to take some time to make that happen. The only way it can happen is through the vaccine process. And in the meantime, until people get that vaccine, we've got to continue to have people stay home as much as they can, to wash their hands, watch their social distance, and wear their masks. These are unprecedented times. We've been through this. We're on day 303. We talk about this every day. It isn't a game. It's not a game at all. There is light at the end of the tunnel. Vaccines have been found to be effective, and there are more vaccines that are perhaps coming online. We heard Sam say that these vaccine clinics are being set up, but it all is going to be dependent upon the appropriate amount of vaccine being sent to our community, and that's why we're working with the state. The state's working with the federal government to deliver the amount of vaccines that we're going to need to be able to get this community vaccinated and get that immunity out there to a level where we can all get back to where we want to be, back to normal.
The next person wrote, is there any talk of opening restaurants at any capacity so we don't have a ton of unemployed workers or owners and vacant buildings? This has to end sometime. Florida has less restrictions and less sickness per capita the last time I checked.
Well, our regional positivity today, 12.6%. That's the state number. Unless it gets back below that 6.5% level, I don't see the state changing the way they are going to be allowing reopenings to occur. That being said, there are other areas of the state that are reaching that 6.5% level. It isn't us. It isn't here. And so that's why if people want things to reopen, they're going to have to get these numbers down. We're going to have to band together and do the things that are being asked so we can get our numbers down so that we will be part of the reopening process. As it stands right now with the positivity numbers that we have, with the amount of people we have in the hospital in the region, it doesn't appear likely that the state will allow us to reopen. It isn't that we don't want to reopen, it's just the numbers show that we have too much spread in the community. And when you look at our numbers of people who have gotten COVID in St. Clair County, we're still below 10% of the people that have gotten this virus. There's a lot of people that live here that haven't had the virus knock on their door yet. That's why we have to keep vigilant and make sure that as few people contract this virus as possible in our county.
Okay, Chairman, and one last one that came in says, how come when I drive past bars, there are a number of cars in the parking lot and no one outside? Who is in charge of enforcing the outside only at bars and restaurants?
So bars are controlled by the liquor commissioner of that particular jurisdiction. The best way that you can gain compliance with bars is if the liquor commissioner acts and says your license is in jeopardy if you don't comply with these mitigations. So you need to take a look at your zip code and take a look at the zip code where these establishments are that are causing problems. And if those zip codes are particularly high, of which we have many in the county that are high, and we talk about those numbers every day, call that liquor commissioner and say, hey, what about your zip code? What about the fact that you have a high number of COVID positives in your zip code? Shouldn't you be acting? I mean, you really need to contact the local liquor commissioner. You can contact us. We certainly send people out. We try to gain compliance. We work with people. We don't want to shut places down. We want to just ask people to be compliant, require the masks, the social distancing, and abide by those mitigations. The mitigations that are simply designed to keep these numbers as low as possible until we can get people vaccinated and get the immunity in our community that we all are looking forward to.
Okay, and the last thing that came in was just a comment. This person said, I want to thank each of you for your dedication. I understand it's your job, but for 300 plus days, you've been putting us, the citizens of our county, first. None of you should be expected to do that, so I thank you all for your service.
Well, thank you for that last comment, and Chairman, I'm glad you got to answer the one about the end game because, and I echo your sentiment and your comments that this has not been a game, and I take offense to 303 days of somebody even trying to insinuate that it was a game. Everybody, Team St. Clair, everybody at the EMA, everybody at the St. Clair County Health Department, the Eastside Health Department has taken this seriously 24 hours a day for 303 days here. So I thank you for that comment of sending it in, but and then as I sit here this afternoon, there are a few of you out there that think you have your medical degrees and your science degree and want to sit here. We have said from day one, we are going to follow what the experts tell us. The physicians that's been on here, the medical experts, the people who do this for a living. We are the messenger. We are the ones who here are trying to keep 270,000 citizens in our county safe, and we're going to continue to do that. So you can sit there and digest all these numbers and come up with your own theories, but it's a conspiracy theory. We're not basing this on conspiracy. We're basing this on the facts that are presented to us. We've got today 354 of our residents in this county that aren't with us anymore. Across the state, 17,574 that has lost their life. If anybody thinks that's a game, we're not going to play that game. So please, let's make sure that we are a part of the solution and not the problem. This isn't a game, as we said. We'll be back with Cindy and Daisy in a few minutes to translate this into our Spanish communities, and we'll be back tomorrow for day 304. Have a good evening.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will stand strong.